Hi, this is Dr. Susan Sarajari from Dominion Fertility, and I just wanted to say a few words about genetic carrier screening, which is actually recommended by the American College of OBGYN for patients who are trying to get pregnant or patients who are pregnant. Most babies born with rare genetic diseases are actually born to patients who do not have a family history of the genetic condition. So it is really a good option to get checked. Most of us are carriers of DNA changes that usually do not affect our health. But if both partners are carriers for the same DNA change, then potentially the baby could be at risk for a genetic disease. So genetic carrier testing is done very easily, and it tests for over 280 genetic conditions. It can be done either by simply doing a blood test or by collecting saliva and then doing the test. If a patient comes back positive as being a carrier for a condition, then we usually recommend the partner to also get screened. If the partner is also positive for a condition, but the condition is different than the patient's condition, then the baby is usually, or most of the time, not at risk of a genetic disease. However, if both partners have the same genetic change, then there is a risk for the baby to actually have a genetic disease. And in these situations, we usually have the patient talk to a genetic counselor who can give you the details about the risk and the inheritance pattern. Then the patient has the option of doing pre-implantation genetic testing of the embryos for this particular genetic disease, so that then embryos who do not have the condition can be transferred and the couple can have a healthy baby. So if you're interested in genetic carrier screening, talk to your OBGYN or your fertility provider to possibly have that done before you're planning on getting pregnant. It's Dr. Susan Sarajari from Dominion Fertility. Thank you.
Dominion Fertility, making miracles happen, one family at a time.